So what is anxiety? Anxiety is a normal emotional response to real or perceived threat and is characterized by fear and worry. The amygdala is a structure within our brain that has been thought of as sort of the worry and fear center, and we will talk about that in a moment. This is the brain. This front part of the brain is called the prefrontal cortex. A part of the prefrontal cortex is an area known as the orbitofrontal cortex, which sits on the bottom side or the inferior side of the frontal lobe. Orbitofrontal cortex makes sense because the vision pathways flow right underneath. The amygdala is the red structure, which is considered the fear and anxiety center of the brain. It's located anterior to the hippocampus within the temporal lobe. The brainstem consists of the pons, the medulla, and the midbrain. The thalamus is the green structure that sits just medially to the neostriatum, which is the caudate and putamen, the blue structure shown. These are all very important structures that we are going to talk about in a moment. But to give yourself an idea of where these structures are in the brain, I wanted to review the anatomy. By the way, this is a sagittal section in which we're looking at the brain cut in half from the side. The amygdaloid complex, also known as just the amygdala, consists of a bunch of neuronal cell bodies clumped together. What we call these neuronal cell bodies, or cell bodies of the neurons, we call it a nucleus when there's a cluster of these neuronal cell bodies. There are numerous nuclei within the amygdala or amygdaloid complex. There are about 12 pairs of nuclei. However, for anxiety and for the purpose of this discussion, we will only talk about the lateral nucleus, the basal nucleus, and the central nucleus. Inputs to the amygdala are important because the amygdala is very much involved in initiating the fight or flight response that is very important in our survival. Inputs to the amygdala include the thalamus, the sensory cortices, in other words, the parts of the cortex that process our sensory stimuli like vision, touch, smell, the ventromedial prefrontal cortex, VMPFC, and the orbitofrontal cortex, and the anterior cingulate cortex also send neurons to the amygdala. The hippocampus, a very important structure in memory, also sends signals to the amygdala. All of these structures send their signals to the lateral nucleus. From the lateral nucleus, the signal is transmitted to the basal nucleus and/or the central nucleus. And the central nucleus is the primary output pathway in the fight or flight response. Now, that doesn't mean that it's the only output pathway, but the central nucleus is highly connected to the hypothalamus and the brainstem. The hypothalamus and the brainstem both very much involved in the autonomic response that are associated with the fight or flight response. This diagram is very complex, and we will talk about it in more detail and simplified in a moment. So don't be discouraged if you're finding it difficult to follow. Again, the central nucleus is a part of the amygdala. It's not the only output pathway or output center of the amygdala, but it's very important because the output of the central nucleus of the amygdala is critical to initiating and maintaining the fight or flight response. What I mean by that is outputs of the central nucleus of the amygdala go to the hypothalamus and the brainstem areas. The hypothalamus and the brainstem areas then cause the sympathetic activation, the stress response, and the behavioral patterns that we see in people and animals who display the fight or flight response. So from the hypothalamus, you will get sympathetic activation with increased heart rate, your blood pressure will go up, your pupils will dilate. Corticotropin releasing hormone is stimulated from the hypothalamus, which then ultimately leads to cortisol release from the adrenal. The brainstem areas, such as the periaqueductal gray, which is very important in pain modulation, become activated. inducing stress-induced analgesia, which is basically when you are in the fight or flight response, we know that this diminishes the pain signals that are coming in. This is good for survival because the last thing you want to do is be focusing on pain as you're trying to get away from a very stressful, threatening situation. Periaqueductal gray, when stimulated in animals, is also causes a freezing behavior. Stimulation of the locus coeruleus within the brainstem causes widespread norepinephrine release. Along those lines, acetylcholine is also released after stimulation of the dorsal ventral tegmental nucleus. Acetylcholine and norepinephrine, when increased in the cortex by this pathway, causes arousal and vigilance. The parabrachial nucleus, which is a part of the brainstem, also becomes stimulated, which increases our respiratory rate. The dorsal motor nucleus of the vagus nerve induces the parasympathetic response, causing upset stomach, acid reflux, and other parasympathetic activity. Activation of the cranial nerve 5, which is trigeminal nerve, and cranial nerve 7, the facial nerve, leads to facial expressions of fear. Let's use an example to better understand how this works. Michael is enjoying a nice walk in the middle of the road, a very dark night with fog and no one around. Not very smart, but this is the story that we're coming up with. So Michael's walking down the street. He is by himself. All of a sudden, boom, a clown pops out. And the stress response, or the fight or flight response, is initiated. This causes Michael to run because he is afraid for his life. So what's happening when all of this is happening to Michael? Prefrontal cortex, again, that front part of the brain, the orbital frontal cortex, on the bottom, the amygdala, the brainstem, the thalamus, and the striatum. These are all important structures to remember. So what happens? As Michael's walking down the street, he is scanning the environment, making sure that things are safe. All of a sudden, he notices the clown jumps out. Visual cortex is activated because he is now seeing a very scary clown. His hippocampus is activated as it's trying to look through the memory bank to identify if this has ever been encountered before or this type of situation has ever been encountered before. The ventromedial prefrontal cortex and the orbital frontal cortex both become activated because these areas are involved in emotional processing and tend to have an inhibitory effect at the amygdala. The ventromedial prefrontal cortex and the orbital frontal cortex have inhibitory input via GABA neurons that inhibit the lateral nucleus. However, the thalamus and the sensory cortices use glutamate and stimulate the amygdala. What this tells us is that the cortex, specifically the sensory cortices, the somatosensory cortex, the auditory cortex, the visual cortex, stimulates the amygdala. However, the ventromedial prefrontal cortex and the orbital frontal cortex, they come in and say, well, this is not that big of a deal, and or we're looking into this and this is not anything to be too worried about. So they have inhibitory inputs. It's the balance between these two that are important in the fear response. In other words, in order to be sure that the fight or flight response isn't overly activated or activated under conditions that are inappropriate, the ventromedial prefrontal cortex and orbital frontal cortex are there to do just that. It's this fine balance that's very important. And in order to diminish or reduce the fight or flight response, you really need a functioning ventromedial prefrontal cortex and orbital frontal cortex. They've done this study in animals when a lesion, the ventromedial prefrontal cortex and orbital frontal cortex, becomes very hard to diminish or reduce the fight or flight response. What is conditioned fear? So in order to understand anxiety disorders, it's very important that we talk about how anxiety develops, or how we think that anxiety develops from a neurologic or neurobiologic perspective. And to illustrate the idea of classical conditioning, we're going to use this model of a dog. And the dog is fine, just resting normally. There's an unconditioned stimulus, a shock, which is applied to the dog. The dog then responds in a way that shows us that he's scared or in distress. This would be considered the unconditioned response. In other words, you shock the dog gets scared. That makes sense. What about ringing a bell, a neutral stimulus? Well, when you ring the bell, the dog doesn't respond, doesn't do anything. It's not scared. It did nothing. But interestingly, when you pair that neutral stimulus, the bell, with the shock, and you do this many times, what ends up happening is the neutral stimulus then becomes a conditioned stimulus, in that after you've paired the shock with the bell over a number of times, the animal, the dog, will respond even when the shock isn't there. In other words, it has learned that shock plus bell equals bad. Bell by itself is associated with the shock. Therefore, when the bell rings, the dog is anticipating that a shock will come, and it will display frightened behavior even when a shock is not there. So even neutral stimuli will initiate the fear response as a result of associative learning. So the example of a traumatic event in childhood is a good example for how the anxiety disorders can develop, because when you're in childhood or even adulthood, when something bad happens to you, something very stressful, whatever was going on at the time, your environment, where you were, the smells, the sounds, the sights, whatever it may be, have all been associated with this terrible event. And what ends up happening is that neutral stimulus, which to anybody else seems perfectly not frightening and not an issue, then becomes a trigger, a problem, because it has been associated with a very terrible experience. That's conditioned fear. What about conditioned fear extinction? What the heck is that? Conditioned fear extinction is really the way that we treat anxiety disorders and the reasoning behind it. And I'll explain that in a moment. So we go back to this diagram, the conditioned fear response. Again, the unconditioned stimulus, the shock, with the neutral stimulus of the bell, leads to the conditioned response of the dog being very upset because it was shocked. When we do this number of times, the dog then learns that the bell is associated with the shock, and it will respond even in the absence of the shock. But interestingly, if you continue to use the bell, but don't use the shock, and you do this a number of times, what's interesting is that the dog slowly over time learns that the bell is no longer a threat. And pretty soon, it becomes a neutral stimulus again. Because what it's done is it's learned a new pathway. So this is not that the dog, is forgotten about the event or the shock. This also doesn't mean that people just forget their trauma over time. That's not what happens. Forgetting is not erasing. Forgetting means new learning. And new learning means making new connections and strengthening and weakening old connections. So while that pathway that was strengthened when the dog was being shocked and the bell was rung, over time, after you've only used the bell and not the shock, the dog begins to learn and make new pathways and strengthen new pathways that say, well, it's not a big deal, just a bell. The ventromedial prefrontal cortex and the orbital frontal cortex are very important in diminishing the response to external input. So what I mean by that is what the ventromedial prefrontal cortex and orbital frontal cortex do is they reason and they assess and they say, well, this is not really a big deal. This is not anything to be worried about. And it inhibits the activating input from the cortex. Another reason why GABA, the inhibitory neurotransmitter in the brain, has been implicated in anxiety disorders. And certainly the benzodiazepines, which are GABA A receptor enhancers, work well for anxiety. What about worrying? Is worrying any different than anxiety? So worrying is a cognitive process in which a person is concerned about a potentially threatening event in the future. It's worrying is about the future and what might be. And now this may be normal. For example, when you're about to take a test, you may feel some anxiety, some worrying about the test. But if it becomes excessive, it can be debilitating, and it can take over your life. Worrying is a key symptom or a core symptom of panic disorder, generalized anxiety disorder, social anxiety disorder, and obsessive compulsive disorder. So how does worry work in the brain? Here's the diagram that we showed in the beginning. You have the prefrontal cortex in the front, the orbital frontal cortex on the bottom, the brainstem, the thalamus, and this neostriatum. If we were to turn the brain a little bit, you would see on the side over here on this side, is that what we call the dorsolateral prefrontal cortex. So if this is the ventromedial prefrontal cortex here, because it's on the medial, in the medial aspect of the frontal cortex, or the prefrontal cortex, this is over here, the lateral side, right? It's on the lateral dorsal side. Call that the dorsolateral prefrontal cortex. The orbitofrontal cortex still under here, and the thalamus here. These structures form a circuit. And the circuit is called the cortical thalamic striatal cortical circuit, and we call this the worrying circuit. This is because this circuit becomes highly activated in individuals who worry. It becomes a loop where obsessions and constant worrying occur. What we know about the orbitofrontal cortex is that in individuals with OCD, when you scan their brains, have overactive orbitofrontal cortex, and this has been thought to cause obsessive thinking. To understand the worry circuit, let's consider the following example. Sally and Dave. Sally has OCD, and Dave does not. Dave is driving down the highway on his way to work, and a thought pops up in his head. He asks himself, wait a minute, did I lock the door? Did I lock the front door? The orbitofrontal cortex immediately sends a signal of alarm and starts the worry circuit. But Dave's dorsolateral prefrontal cortex and other areas of the brain process this information, and he quickly rationalizes that, you know what, no, I've never done this before, and I'm pretty sure I locked it, and even if I didn't, we have a great alarm system. That's Dave, who doesn't have OCD. What about Sally? Sally, who also is driving down the road, has OCD, and suddenly a thought pops up. Oh, did I lock the door? But Sally can't recall whether she locked the door or not. Her orbitofrontal cortex sends a very strong signal through the worry circuit, and this keeps going over and over and over and over again without that dorsolateral prefrontal cortex, that reasoning part of her brain, kicking in saying, oh, no. This is irrational. It'll be okay. Everything's fine. It's not a big deal. Because it's not kicking in, because that dorsolateral prefrontal cortex, that reasoning center isn't kicking in, Sally turns the car around and goes back home and checks her front door. She does this a few times. She opens the door, closes it, locks it, returns back to the car. But when she gets back in the car, again, the worry circuit becomes activated again, because in individuals with OCD, the orbitofrontal cortex and this worry circuit is overactive. And then she obsesses about it again. She gets out, checks again, and does this over and over and over again until she's late. The worry circuit also has connections with other areas of the brain, limbic areas, cortical areas, the amygdala, the hippocampus, the hypothalamus, and all of these together work simultaneously to produce those symptoms that are so common in worrying, whether it be the upset stomach, the butterflies, the hyperventilating, heart racing, inability to think straight. This is what the worry circuit does.